Well, hey, welcome to another Alex episode, and this one is probably number 16 in the series. Today is March 10th. It's been a lousy week or so. I put up the last video, and all that stuff is sort of still ongoing. I'm filming this Alex video in a different room of my mother's house, which is where I live right now for the next, indefinitely. Basically, I'm going to pass on a few things about the last little bit in my life and give a little advice to any of the kids out there. The first thing is I'm reading a lot about the GAPS diet, which I tried and flip-flopped off and on for a while after getting off psychiatric meds, and then also taking antibiotics for injury. And so I got the book, Gut and Psychology Syndrome by Natasha Campbell McBride, and I really recommend that book. I am not a doctor, nutritionist, or anything like that. But I recommend it because it has an alternate kind of take on things and makes a point about how important the balance within the intestines between positive good guy bacteria and negative bad guy bacteria, and what can happen when you have different kinds of things going on gastrointestinally. Sort of has a focus towards autism and stuff like that, but most of the lessons, if they're right, would seem to be applicable to pretty much a variety of circumstances and situations. I went to my physical therapist. I have a physical therapist, so I'm lucky about that. And she was just freaked out. I hadn't seen her in 3 weeks, and Alex has lost weight, and that was weird. It's terrible being treated like you're some diseased creature, but I continue to have a lot of pain and symptoms and stuff like that. So I maybe have a viral infection on top of the stuff I'm already dealing with, or I might have developed fibromyalgia, which is, or both of those things. And fibromyalgia is a very non-specific diagnosis, it seems to me, because I don't know. Seems like we don't understand. It tends to affect women and also people, who have taken antibiotics or had a traumatic or emotional stressors, or just physical stressors like infection or stuff like that. So anyway, that's about the whole update for this week. So check out that book if anybody ever watches this. I noticed I get a couple comments here and there, so I appreciate that. I guess I don't really expect anybody to watch these, but maybe somebody out there can learn from my experience with multiple doctors making bad decisions and realize that the guys in the white coats with the initials after their names are just people, and probably actually more prone to making mistakes because they're dealing with people who, in my opinion, they tend to see as at least 1 or 2 levels beneath them, and that is people who take mental health or psychiatric medication. So if you want to be treated that way, I found that psychiatrists and whatnot will have varying degrees of empathy, but so far I've not met one, and I have a good sense of people that I see views me a sense of being on a parallel or the same plane as they are. That is to say, they are a superior person than I, because they're the ones on that side of the room in the comfortable chair, and I'm the one on that side of the room in the patient chair. So I think that makes them a little more prone to mistakes, a little more prone to discount what people like me say, because we are not expected to be accurate. So anyway, that's this week's Alex video. Next week I'll have some exciting news on test results.